I'm Dr. Fidel Goldson from Goldson Spine Rehabilitation Center, where our motto is to turn up the life. We've been serving the community for over 30 years, multiple locations between Port St. Lucie, Lehigh Acres, and Broward County. Our goal as a chiropractor at Goldson Spine Rehabilitation Center is to ultimately provide the best wellness and balance that we can give to our patients. So many times patients may be involved in an accident or just looking for a lifestyle change that will help to optimize their life. So when we're thinking about wellness, you have the most control over your own wellness. I, as a chiropractor or any other physician, with the time that we have with you, can give you the best advice, but ultimately you have to live with you. And we know how hard it is to get enough sleep at night. We know how hard it is to have the motivation to exercise, to eat right. The list can go on. But chiropractically speaking, we want to look at it from a natural sense. So over the past 30 years, we've had different weight loss types of programs to assist patients to help meet those goals. Most of those included supplementation and or diet plans. Clearly, over the past 5 years, there's been magic in medicine, and there's multiple and various ways now that you can lose weight. And semaglutides are now Ozempic, or the other name brands are essentially now the, I guess we say, lowest hanging fruit for most people when they're thinking about lose weight. My friends, other people that I know have used it and have been having success with it. Initially, I have to be very honest with you. I thought it was a cheat code and it didn't sound so natural. But as a chiropractor and any other doctor or any other physician, we're always practicing. We're always in practice. We can always learn more. So I wanted to get more information, and I wanted to bring you more information regarding it. And if it can optimize and help your life, then great. Today I have a wonderful, wonderful guest with me, Rock. Hello, Rock.
Hi, how are you?
I'm fantastic. Rock and I met a couple of months ago. He's a nurse practitioner for over 10 years, and he's been courteous enough to spend his time to share information with you. And I hope I asked the right questions to give you the right answers, but you can always clearly put it in the comments or send us the question. But so first, I want to say thank you, Rock, for making the time today.
Thank you for the opportunity. I appreciate it.
Absolutely. So we'll jump right in. So you're a nurse practitioner. Can you tell me what kind of educational background it requires to be a nurse practitioner?
So as a nurse practitioner, I studied under a few internal medicine doctors. I've worked with them for several years. I also worked with a family practice as well that does basically family practice from patients that are the age of geriatric to infant as well. And so throughout the course of the 10 years, I was able to have all that experience with the internal medicine doctors and family practice as well.
Awesome. What was the passion that moved you into not just healthcare, but specifically to become a nurse practitioner?
So I've been a nurse for over 20 years, and I've I touch on every field that I could touch. I found a niche, which was family practice, which I kind of enjoy. And just to get that satisfaction from the regular patients, just to have more hands-on and to help direct their care. So I tend to like that more.
So on the wellness side, the working with families, that resonated with you?
Yes.
That resonated with you. So I'm going to run off some questions. First, can you tell me how to pronounce semaglutide?
You're pronouncing it correct. Okay. Semaglutide is the word, but everybody's starting to use GLP, glucagon-like peptide. They're starting to use that verbiage more than the semaglutide, but what we tend to use is the compound version of semaglutide.
Okay, what does that mean?
The compound version is not the original brand name of Ozempic or Wegovy, but the generic form.
Okay, so it's basically the generic form of any other medication that you can get. And so most people, when they're getting their prescription, most often they go for the name brand, or not most often, but they will tend to likely go for the name brand because it's a name brand. But then there's the cost aspect to the generic. But then the first thing comes to mind for most people is, what am I losing if I go from the name brand to the generic? And how would you answer that question?
Well, I've done both. I've been in the family practice where I did order Ozempic, and I am in the wellness program where I did provide the semaglutide. You're not losing anything. It has the same efficacy of both medications. You're not losing anything. Both of them are great. It's just a cost aspect.
So chemically speaking, like how it looks on a chemical profile. Is it the exact same thing? What you and I are talking about in semaglutide and the Ozempic, is it clinically the same or is there some difference chemically?
It's chemically the same. It's just the delivery system that they use is different. So I believe that with the semaglutide, the delivery, not the delivery, the Ozempic has that pen that feature the pen.
Okay.
With the semaglutide, they could give you pre-filled syringes or the vial that you draw up yourself. So chemically, they're both the same.
Got it. It says administration of it.
Correct.
And I've never seen the Ozempic pen, so I guess it's click and something like that. It's simplified and it's okay, it's prepackaged, essentially, is what you're saying.
Correct.
Okay. And so tell me, what is the normal process for someone who is interested in losing weight and was considering a semaglutide?
So the prerequisite for it has to be you have to be overweight. You have to have a BMI, body mass index of 27 or greater. So once we weigh you and we realize that you're over your BMI, then you're qualified for semaglutide treatment or medical weight loss. In addition, we like to rule out thyroid cancer if you have thyroid cancer in your families, because that is contraindicated to start the program. Also, we want to make sure that you have one of the comorbidities, diabetes, hypertension, anything that necessitate for you to start the semaglutide.
So first, you have to be overweight, clinically overweight, which is a body mass index. That's a measurement between how much you weigh and certain areas of your body, measurements of that. So if you're round, so you can basically, essentially, it's not by weight, it's by your body type and your weight, correct? So you determine the body mass index, right?
Correct. Yes.
So, and then that's the first thing, and then comorbidities existing as well. But you mentioned the thyroid cancer uh, being a contraindication.
You're right.
Thyroid is the gland in our neck right here that basically produces hormones that basically speeds up our body or slows down our body or works on our metabolism, essentially. Why is that a contraindication? I mean, all cancers, essentially, I could see that, but why thyroid is particular?
So in the package of semaglutide or Ozempic, once you do the assessment form, they say that at least 10% or less may develop the thyroid cancer, and that's a contraindication of taking
Got it.
medication.
All right. Okay. So that they say that could possibly be a side effect, but they're not really sure. So if you already have it, don't worry about it. Got it. Okay. So I have a friend, a really close friend of mine, my oldest friend actually. He got a diagnosis. They say, hey, you need to start exercising. You know, at that age, this age we get to, and you start getting that, the blood work starts coming back a little different now. So, hey, you can start start jogging and get things in a better order. He was on it. Like he lost 13 pounds in 3 weeks just by jogging, maybe a month. But you can't really keep up that pace, and your body sometimes breaks down because as you're getting older, you're actually breaking down. So now, for him to run 3 miles a couple of times a week, he's starting to have knee problems, and the knee and the foot problem adds up to he can't work out anymore. And that happens to a lot of people. They start with the best intentions that they're going to exercise, and essentially after a while, if you have a soreness or pain, hopefully you come see us soon so you can get back to exercising. But most of the time, intention falls away to, life, and they just stop working out because of the pain. So he had to stop. Um, but then he said, hey, I'm thinking about taking the shot. Right. And essentially, he did take the shot. Over the past couple of weeks, he's been taking it. And initially, right out of the gate, his lifestyle change and his weight loss equaled up to it, made sense for him. He started to plateau, though, over about, I don't know, maybe after a month. So, first, I want to address, like I mentioned earlier, I thought it was a cheat code. How much should someone expect? Because now we're talking about what should I expect if I do this? If I take an injection periodically, and you can tell me how often that is, what should somebody expect after they get in?
So the rule of thumb is to try to the expectation to at least start the semaglutide for at least 3 months.
Okay.
The reason why semaglutide and chiropractic care could marry each other is because there are some studies that GLP and chiropractic care, how they could marry each other is because GLP has anti-inflammatory properties. So when a patient starts feeling better and therefore the joint doesn't hurt as much and everything else, then they could get better chiropractic and rehab care. The patient expectation is to at least have 3 months of therapy of semaglutide and then we continue to reassess. My job is to monitor their weight, how their progress, their blood work as well. And also I'm gonna have the ability to titrate their medication as soon as they may or plateau.
But because somebody's gonna say titrate, and they're not gonna know what you talked about. So people are lost about that. So essentially, it's not always the same dose.
Correct.
Okay.
Sometimes your body get used to it, and a little change may help to remove the plateau.
Miss Johnson is 5'6", body mass index. She's maybe 56 years old. She's diabetic, and she's been trying to lose weight. Has knee pain. You assess her. She does go with the treatment. She starts the injection. She's injecting herself, or is somebody injecting her?
Either both. Sometimes some patients prefer to inject themselves, or sometimes people could inject for them.
Very important question because this matters. Big needle, small needle. Is it a scary needle?
No, it's not a scary needle. It's a subcutaneous needle, and it's very small.
But that's where people are thinking. So she takes the injection. First week, let's call it a Monday. She doesn't do anything necessarily different in her lifestyle. By the end of the week, has she lost weight?
Everybody's different because it depends on how she was eating before, how busy and active she is. So everybody's different.
Sedentary. I'm gonna hold you to a number here. Sorry. She's sedentary. She's doing what she's been doing. Maybe she's not eating fried chicken every day, but essentially she took the injection. She's living the same lifestyle. What is a reasonable expectation?
So what I've noticed and what I've experienced with some of my patients, they lose 1 pound a week without doing anything. And I haven't seen anybody gain weight since they've been on it. Now, you have more active patients, which does go all extreme, exercise, change their lifestyle, and they may lose up to 4 pounds every week.
Right.
So everybody's different. And that's the reason why we kind of follow them and measure and check up on them as frequently so they stay on track.
I like the more active, the better lifestyle. You marry those two together, and then essentially you're going to have better results.
Correct.
My friend I'll give you his number. He lost 13 pounds, I think, in 3 weeks. It was something like that. And I thought that was amazing, but I told you about the plateau part. And essentially what he said to me was that he was less active. So you get your shot, and you said this an anti-inflammatory. So should the person feel like less joint pain? Is the expectation to have less pain throughout the body? And is there any no steroid impact to the body at all?
No steroid impact to the body. The studies shows that it is anti-inflammatory to the body and joints.
Okay.
How much is it? I don't know, but that's what the study shows.
Okay. All right. So you monitor the weight. So now Miss Johnson came in. She after first week, second week goes by. Let's say what if any side effects at all over the first 1 or 2 weeks? Should they expect anything at all?
So everybody's different. The most side effect that people experience is nausea and vomiting. More nausea.
That is the nausea. And
50% of the patient may experience nausea.
Okay.
Some severe than most. If you are having experienced nausea or vomiting a little too much, then there are medication that I could give for the nausea to subside the nausea. That is expected between the first or 2 weeks until your body start getting used to the medication.
Got it. Why nausea and vomiting? Is it something on your system, or is it literally your body's adjusting to what?
So the body's adjusting to the medication, which is delaying the emptying of your stomach into the intestines. So the part of the reason why you're losing weight is because it slows down the process. And so your body feels full and you're not overeating because your body thinks it's still full. So it's slowing down the intestines, the stomach, and that's why some patients are experiencing nausea and vomiting.
Got it. That's why I actually turned my view on this whole thing, because it's not essentially a weight loss medication, right? It's a medication that actually changes your body to, like you said, slow down, so digest food faster. So food is essentially staying in your stomach for a longer period of time.
It's staying a longer period of time. The medication also signals your brain that you're full. Also, the medication signals the pancreas to produce more insulin, or it keeps your blood sugar low. So The overall, even in addition to the lifestyle changes, so we got to remember that obesity is a serious disease, and we have to attack it very serious and aggressive.
Right. High blood pressure, um, diabetes, um, stroke, joint and knee problems, and more, many more, can all be associated with obesity. So it's so much to your lifestyle. Mental and emotional health is very much tied to obesity. So you're right. So if we can impact lives while giving you a chance to recover from being overweight or being obese, there's it's very possible. The possibilities are endless of how well you could feel because your body is in a better chemical, metabolic, which just means how it's functioning in and out, the energy and the cold, how your body's functioning from a joint perspective and from a mind and a confidence perspective.
Correct.
Right. So it's hard when you are in an advanced. I'll tell you a little story. My daughter was in an advanced class, and when she first started high school, and I was all gung ho about it. I was like, yeah, do it. You're gonna get dreams, all these dreams, right? You're gonna do great. And she was so excited. And she got into this advanced class and did good in the beginning, but after a while struggled. It was just kind of over her head. And anytime you're dealing with, and not many of us, dealing with something that's over your head, you get really depressed about it. And it really caused her to maybe not even enjoy high school until we said, you know what, my wife and I talked, and credit to my wife because she said, hey, we just need to change it. And that's after that, she settled in just fine because she was at the level she needed to be. Some of us have a predisposition to knee arthritis. Some of us have a predisposition to just uh, endomorphic body types, larger body types. So with that predisposition, it's good to have an alternative and to get so that you can balance it out and get on the right level. So, couple last questions. Worst case scenario, the stomach is slowing down. Could that create some type of ulcer? Is there a risk factor? Or are there other risk factors that patients should really be concerned with outside of the cancer?
Right. So everything is patient specific. This is the reason why I follow them on a weekly or bi-weekly basis to see how they are, how they're progressing, and how can we treat any further things that comes up or any other side effects that may come up.
Okay. All right. So they see you, you're their counselor in a sense. They're a part of their wellness team. You're guiding their weight loss through that. You're guiding their diet changes. You're looking at maybe any adverse reactions they might be having. Exercise. Should they experience any weight loss in as far as muscle mass, or is it all fat?
So it varies, patient specific as well. It depends on how active they are. If they increase their diet, if they made any lifestyle changes, if they increase their protein or their fiber, how much carbs they're taking. So everything is patient specific, and we review that on a bi-weekly basis as well.
Got it. Well, first, last, I want to say thank you for spending your time and bringing great information. It's awesome to see men in our community who look like us doing so well and having a passion for helping everyone in the community. So we look forward to partnering with you and providing all of you who are out there or who are still curious, who may think this may be for you, or maybe for a family member of yours who you've been encouraging to help with their wellness and weight loss journey. Give us a call at 866 Goldson. We have Dr. Rock on team to help answer any questions and to set up an initial consultation. And if you want more information on how to set up that initial consultation and the pricing for that, can you tell us how much that initial consultation is?
Consultation is $175.
Okay.
Is a consultation, and we'll go review everything as needed.
So for $175, you get to see Rock, the nurse practitioner, about your weight loss journey, about your wellness journey, and get more information about what options might be best for you if it's semaglutides or anything else. And you're probably, at worst case, you get a lot of information. So again, call 866 Goldson, 866 465 3766. It's so good to bring you information. Have a blessed day.